Hi everyone, this presentation details my Doctor of Nursing Practice Scholarly project, which focused on improving glycemic control in older adults living with type 1 diabetes through a structured nurse-led diabetes self-management education program. As the population ages, more adults are living longer with type 1 diabetes and they face unique challenges such as fluctuating glucose level, insulin regimen complexity, cognitive changes, and comorbidities that increase vulnerability to complications. Throughout this presentation, I will explain the background and significance of problems, review key evidence in the literature, describe the theoretical framework guiding the project, outline the methods and design, present the timeline and results, discuss limitations, and explore implications for practice. I'll also reflect on how this project influenced my development as an advanced practice nursing student and how it aligns with DNP essentials. This presentation represents not only the culmination of my project but also my growth in clinical leadership, evidence-based practice, and population health improvement. Older adults with type 1 diabetes face substantial challenges related to glucose control, complex medication regimens, comorbidities such as cardiovascular disease and chronic kidney disease, and increased risk for hypoglycemia. Many struggle with health literacy, self-care confidence, and understanding how to adjust insulin, diet, and activity safely. Poor glycemic control in this population leads to preventable complications, reduced independence, increased healthcare utilizations, and decreased quality of life. The purpose of this project was to address these issues by implementing a structured nurse-led diabetes self-management education program tailored to older adults by improving self-management skills, increasing knowledge, and reinforcing safe insulin techniques. The goal was to improve A1C levels and enhance self-care behaviors. This project is significant because older adults often do not receive diabetes education that's adapted to their unique needs. Providing targeted education can prevent complications, reduce hospital admissions, and support aging in place, an important priority in chronic disease management. Extensive research shows that diabetes self-management education is one of the most effective interventions for improving outcomes in individuals with diabetes. According to the ADA Standards of Care 2024, DSME is essential for establishing behavioral strategies, supporting medication management, and improving glycemic outcomes. Studies consistently show that individuals who receive DSME experience lower A1C, fewer complications, and improved quality of life. Nurse-led DSME program in particular have demonstrated strong outcome because nurses can spend more time with patients, provide personalized teaching, reinforce self-efficacy, and deliver culturally responsive education. The DSMEQ tool used in this project has been validated as a reliable instrument for evaluating behavioral changes in diabetes management. Research supports its ability to measure meaningful improvements in diet, glucose monitoring, insulin use, and physical activity. Collectively, the literature supports implementing nurse-led DSME as strategy for improving outcome in older adults with type 1 diabetes. The chronic care model guided the development and implementation of this project. This model emphasizes the importance of proactive, patient-centered team-based care for chronic disease management. It highlights six interconnected components: self-management support, decision support, delivery system design, clinical information system, community resources, and healthcare organizations. By applying this model, the project emphasizes skill building, patient empowerment, and consistent reinforcement. The DSME sessions focus on increasing patient engagement, improving health literacy, and promoting sustainable behavioral changes. The chronic care model is particularly effective for diabetes care because it prioritizes long-term disease management rather than episodic interventions. Its structure supported the development. Its structure supported the development of DSME program that was organized, evidence-based, and aligned with best practices in chronic illnesses management. This framework visual this framework visuals emphasizes how the components of the chronic care model interacts to improve chronic disease outcomes. Self-management support was the backbone of the DSME program, helping older adults gain confidence in managing insulin, diet, and symptom monitoring. Decision support ensured the program followed evidence-based guidelines, delivering system design, reinforced the structured weekly DSME format. Clinical information system was Clinical information system provided reliable tracking of A1C and DSME care results. Community resources, including family support and clinic follow-up, help participants apply what they learn. Understanding this conceptual framework helped explain how the DSME program was intentionally designed to reinforce long-term diabetes management behavior. A pre- and post-intervention quality improvement design was chosen for this project because it allowed direct evaluation of change over time within the same group of participants. This design was commonly used for educational interventions where the goal is to evaluate improvement in behaviors and clinical outcomes after structured learning program. The DSME program consisted of weekly sessions over 10 weeks covering insulin management, dietary strategies, glucose monitoring, physical activity, food care, and hypoglycemia prevention. Material were adapted for readability and cultural relevance, ensuring that participants understood and could apply the information. The structured approach created consistency in delivery and provided ample opportunity for reinforcement and practice. Practice and clarification, all essential for older adult learner. The design supported capturing both clinical A1C and behavioral DSMEQ changes in a meaningful way. This timeline this timeline outlines the week-by-week development of the project. Week 0 included baseline assessment and introduction to the program. Week 1 to 3 delivered foundational DSME content, including insulin literacy, glucose monitoring, and basic nutrition. Week 4 provided reinforcement and target education on areas where participants needed additional support. Weeks 5 to 9 continue structured DSME, allowing participants to build on previous sessions and apply learned strategies. Week 10 consisted of follow-up assessment and evaluation of the intervention's effectiveness. This consistent pacing helped ensure knowledge retention and allow participants to gradually implement and strengthen their self-management behaviors. This project included 20 participants aged 65 to 83 years, representing a diverse clinical population. Diversity in age, ethnicity, and comorbidity strengthened the real-world applicability of this project. Baseline A1C levels are average 9.4, highlighting the need for intervention. All participants completed the program and both assessments resulted in 100% retention rate, a significant achievement on older adults populations. Retention suggests that the DSME program was well-structured, accessible, and engaging for participants. The sample allowed for consistent analysis of pre and post intervention outcomes and strengthened the internal validity of project findings. The Wilcoxon sign rank test was selected as the primary statistical method because the sample size was small and the data didn't follow a normal distribution, making parametric testing more appropriate. This test evaluates whether there is a statistically significant adherence between two related groups, in this case pre and post intervention A1C and DSMEQ scores. A p-value of less than 0.5 0.05 was used to determine statistical significance. They used both objective clinical data A1C and validated behavioral assessment tool DSMEQ provided a comprehensive evaluation of intervention impact. This approach ensured that the changes were not only clinically meaningful but also supported by measurable behavioral improvements, reinforcing the importance of DSME in long-term diabetes management. Results demonstrated meaningful improvement in clinical outcomes and diabetes self-management behaviors. The average A1C decreased from 9.04% to 7.65% following the intervention, an improvement substantial enough to reduce the risk of complications and improve overall metabolic stability. DSMEQ scores also increased significantly, reflecting improved adherence in areas such as glucose monitoring, medication use, diet, and physical activity. Participants who attended all sessions showed the greatest improvements, emphasizing the importance of consistent engagement. The combination of visual aids, repetition, hands-on practice, and personalized teaching contributed to a strong outcome across the group. These results support the effectiveness of the structured DSME program for older adults with type 1 diabetes and align with existing evidence in the literature. The DSMEQ outcomes graph highlights notable behavioral improvements across all domains of diabetes self-management. Participants demonstrated increased confidence in their ability to manage insulin, follow recommended diet, monitor glucose levels appropriately, and maintain physical activity. Behavioral improvements are essential for sustaining long-term glycemic control and preventing complications, making these DSMEQ gains particularly significant. This graph demonstrates a reduction in A1C from 9.04 to 7.65% after DSME program. The meaningful decrease suggests improved insulin management, dietary decision making, and consistent glucose monitoring. Achieving this level of reduction in a relatively short intervention period underscores the effectiveness of nurse-led DSME and highlights the importance of tailored education for older adults. This improvement reduces long-term risk of complications and enhances overall quality of life. The slide reinforces the behavioral improvements reflected in DSMQ scores. Participants demonstrated a better understanding of meal planning, carbohydrate counting, glucose monitoring schedules, exercise habits, and medication adherence. These behavioral changes serve as the foundation for long-term glycemic control and chronic disease management, especially among. Also, this slide emphasizes the metabolic improvements observed through A1C reductions. Lower A1C level reflect improved glucose stability and better adherence to insulin regimens, dietary guidelines, and daily self-care routine. Sustained reduction in A1C are associated with significantly lower risk for neuropathy, um, and then retinopathy and cardiovascular disease. The success of this project demonstrates the value of DSME as a core component of diabetes care. There were several limitations to this project. The small sample size limits generalizability and restricts broader applications of the findings. The single-site design means results may not represent all clinical settings. The 10-week timeframe limits ability to evaluate long-term sustainability of improvements. Additionally, DSMEQ scores rely partially on self-reporting, which may introduce bias or overestimation of behaviors. Despite these limitations, strong retention and consistent delivery significantly strengthen internal validity and demonstrate feasibility in real-world practice. The discussions highlight the alignment between project outcomes and existing research, demonstrating the effectiveness of DSME in improving both clinical outcomes and behavioral patterns in individuals with diabetes. Participants benefited from culturally adapted material, personalized instructions, and repetition, all of the all of which contributed to improved understanding and self-confidence. The findings support broader implementation of DSM programs for older adults and reinforce the role of advanced practice nurse in chronic disease management. The discussions also emphasizes the importance of strengthening support system, enhancing health literacy, and providing ongoing opportunities for reinforcement. This project emphasizes the essential role of nurse practitioners in leading DSME programs. Integrating the DSME into routine primary care can significantly improve patient outcomes, reduce hospitalizations, and lower healthcare costs. Opportunities exist to expand DSME through group visits, telehealth services, caregiver involvement, and community partnerships. The results support advocating for reimbursement and policy support for nurse-led DSME programs to ensure sustainability. This project provides a replicable model for implementing DSME across clinical settings and highlights the values of educating older adults in chronic illness management. In conclusion, this nurse-led DSME program led to measurable improvements in glycemic control and diabetes self-management behaviors among older adults with type 1 diabetes. The project demonstrated that tailored education delivered by nurse practitioner students can lead to meaningful clinical and behavioral outcomes. Future directions include expanding the program, evaluating long-term sustainability, incorporating telehealth-based reinforcements, and developing caregiver-supported approaches. Completing this project enhanced my leadership, clinical reasoning, evidence-based practice, and population health skills as an emerging advanced practice nurse. This work reflects the integration of DNP essential into real-world practice and supports continued professional development in chronic disease management.